Hi, I'm Dr. Carol Clark, and in this segment of You Don't Know What You Don't Know, I'm going to talk about the difference between licensure, accreditation, certifications, and anything else I can think of. I'm the president and director of the International Institute of Clinical Sexology, which offers a doctorate, a PhD in clinical sexology. And I'm also the president and director of Therapy Certification Training, which offers several certifications in a variety of topics, including sex therapy, clinical sexology, hypnotherapy and sexuality, transgender therapy, kink conscious therapy, and addiction and behavioral therapy. So, the Therapist Certification Association, of which I'm president, is the association that awards these certifications. And a certification is a credential that says that you have completed the requirements to become a master, if you will, in the field. If you think back in the old days, they had masters and apprentices. So you would have someone who has attained a high level of expertise and knowledge and ability to practice, and so is therefore certified that they have these abilities, that they've achieved these requirements. And generally, who sets those requirements? Well, other people in the field, other experts, other professionals that have attained that high level of credentialing, of expertise and experience. And they're the ones that set the credentialing levels. So when the Therapist Certification Association certifies you as a sex therapist, for instance, we're saying that you've completed 150 hours of actual class time, that you've completed a lot of independent study work, that you have successfully demonstrated during case consultation, supervision hours, that you are competent to treat complex cases for sex therapy. And those requirements are similar to the state of Florida, that is the only state that has requirements for use of the title of sex therapist. The state of Florida does not actually certify people. They restrict use of the title, but they have set standards. And then there's a couple of other credentialing agencies out there, associations, that have also set their standards, and we are comparable to them. So that's what a certification is. And a certification is not location specific, it's not geographically specific. So my certification in sex therapy, I'm actually board certified by 3 different boards. I can go anywhere in the world and I'm still a board certified sex therapist. Okay, so it doesn't matter about Florida. But what happens is in Florida, I am licensed as a mental health counselor. I can practice mental health therapy counseling in the state of Florida, and I can call myself a sex therapist because I've met those requirements. And so I'm a certified, board certified sex therapist. My mental health counseling license is only good in Florida because I'm licensed here. So as a licensed professional, Florida and other states and other places around the world state specifically what you can and cannot do, what you legally can and can't do. And there's a board for mental health counseling as well that says what I can ethically do and can't do. And so it regulates the practice in order to protect the public. So I practice under my license, and so people that see me, come to see me as a counselor, they know that there's oversight. They know that the state has said that I've met these criteria and make sure I continue to meet the continuing education criteria, for instance, to be licensed in the state of Florida. The certification also comes with continuing education requirements, but it is different. And if I were simply certified and not licensed, I have to be really careful about what titles I use. I can't use the title of sex therapist. I would be a clinical sexologist. That's not a protected title. And I might have more freedom, but in a lot of places, for a lot of jobs or a lot of ways of practicing, having a license may or may not be beneficial. So I know several people who are not licensed who actually counsel people, but they can't say that they provide mental health counseling or sex therapy because, again, those are protected titles. So they have to be careful how they market themselves. And it becomes a personal choice. Most people go the route of becoming licensed clinicians, but some don't. Some say, you know what, I'm going to be a sex coach. That's not really regulated. I'm going to be a sex educator. I'm going to do these other things. And it will become a little more challenging to do the marketing. How are you presenting yourself, and make sure that you don't break any laws. And that you're, of course, behaving ethically, because we all want to do that, right? Licensure is, again, geographically specific. Your state will make sure that you're licensed. That's who licenses you. And then you can get certified by a board who has set requirements. So, and the certification does have some limitations as to what you can call yourself, what you can do with it, but it also goes anywhere with you. Now you know what you don't know. Thank you.